I'm Dr. Randy Tobler, and this is your virtual checkup. Think about the last time you were the patient, or perhaps the driver for one, headed to the emergency room. Did anyone ask, should we go to the ER or try the nearby urgent care clinic? Well, this is becoming a common question when unexpected problems pop up, especially when your doctor's office is closed or can't see you promptly. Starting 15 years ago with walk-in clinics in retail locations, on-demand options have evolved to include urgent care centers that we might call ER Light. They're for problems that don't rise to the level of an emergency. Ouch! But can't wait until morning. And they're booming. Why the meteoric rise in locations and different options? Well, there are several factors. In comparison to the emergency room, wait times are 50% shorter, about 15 minutes on average. Costs are significantly lower too. We're talking 75 to 80% lower, with the average urgent care visit bill at about $160 compared to $600 for a similar service in the emergency department. And that's if you're paying the bill. Insurers are offering lower copays to encourage urgent care over ER visits, recognizing the better value they represent when used properly. Like the problems they see, on-demand clinics have varying capabilities, and it's a good idea to familiarize yourself with those differences among urgent care facilities near your home and work. Some, like those in pharmacies, retail, and grocery stores, may not have X-ray or blood testing capabilities, limiting their scope to colds, bladder infections, vaccinations, and the like. Others, typically affiliated with hospitals or large healthcare systems, have limited radiology services and can provide common lab testing, as well as repair of minor cuts and even casting for broken bones. So back to the question I posed at the top. How do you know where to go? Start here. If it's a problem you would ask your personal doctor to see, think urgent care. Things like a bad cold, mild bleeding, or a mild burn or earache. Perhaps a black and blue toe or ankle after a close encounter with a table leg, or a rash that's itching you crazy. On the other hand, if it's chest pain, severe shortness of breath, you pass out or have sudden visual changes, weakness or numbness, or if you're bleeding briskly or have an extensive burn, get to the ER pronto. If your baby under 3 months old has a high fever or is listless, probably a good idea too. In the end, you always have a choice, and if you're thinking, this might be life-threatening, call 911. But according to surveys, in at least 1/2 of the cases, your precious healthcare dollars and valuable time would be better spent in the urgent care the next time a whoopsie-daisy visits you. I'm Dr. Randy Tobler. Visit me online at drtobler.com.